Honorable Union Minister Sri K. Raman Khan, respected Chairman of the conference, Dr. Gopal, and Co-Chairman, Dr. Gopinath, Dr. Sidhu, the Director of the host institution, eminent members on the dais, ladies and gentlemen. I am from the Central University of Jharkhand, based in Ranchi. We are 3 years old, established to an act of parliament, and established since 2009. In the last 3 years, we have been able to introduce 16 different programs, all 5-year programs in all sciences and many humanities, engineering, and social science subjects. Since we are a new university, we also have been inviting and accepting ideas on different programs that we can start. We have to start new programs in any case. So we have some good ideas. We said, why not? If it's viable, if it's relevant, if it's useful for society. We have proposed also College for Medical Sciences. We are in touch with, and we're discussing with Dr. Gopala on starting clinical research also in our university. Those are the longer term programs. But for immediate, what can we do about this particular topic that you are discussing? For immediate, we can certainly take part in the preventive aspect. And that's where, from the educational point of view, from the university's point of view, we can initiate and participate in campaigns, in seminars, in awareness programs on how to prevent this disease. Apparently, at least 50% of cancers are preventable. And this is where we can contribute. In India itself, we have over 600 universities, over 30,000 colleges, over 1 million schools, recognized schools. So you have a large forum through the educational field itself, which you can utilize, and through whom you can speak to the public at large, working to the families and working to the public. In each of these, we will require necessarily the involvement of the medical fraternity. Because unless they are involved, campaigns cannot be very well informed. And sometimes we have cases, as you are well aware, that they are more dominant, so some types of cancer are more dominant in certain regions of the country, depending on the food habits and other living standards that they have there. So this is where we can work together even now. And I would welcome anyone, whether it's individuals, groups, NGOs, institutions, to utilize our services and our university as well towards this type of activity. You've heard about, this morning itself we had a session on prevention of cancer, and tomorrow you'll be having a panel discussion on the subject. By preventing cancer, we can prevent the anguish, the pain, the suffering of patients as well as family members. We can reduce the financial burden in setting up facilities, both buildings as well as instruments, for the treatment of this. We can offset the demand of medical specialists for the treatment purposes. So if we join together, it'll not only assuage on these aspects, but also because we address, say, the way of living, the food habits, we can address other debilitating diseases like obesity and cardiac-related problems, diet and diabetes. These can be addressed with the same campaign. And we can build together, if we work together, to build healthier societies. And through healthier societies, a healthier nation. And through a healthy nation, a strong nation. When you have a healthy person, the person also becomes more positive in their attitude. and perhaps then we get a better world. And so I invite you, and I offer our university in any programs that you may have, that we will be willing to participate in those programs that can help build a better country. I do hope that you'll have very fruitful and satisfying deliberations, and I wish the conference tremendous success. Thank you so much.